So what does all that mean about treating people who are in pain? Now we have two different elements here. The first one is that the more somebody perceives their environment as danger, the more pain they're going to have. The other element is that the more somebody perceives everything in the environment and in how a practitioner interacts with them as a new experience, as something that has a big influence, as something that really takes them out of their usual reality, the more effective that treatment is going to be. Even if the whole treatment is a total sham, it's going to have a higher effect if the whole environment helps out with that. So we can bring these two together in how we think about how our office is decorated and how every interaction with the patient functions. And this makes it so important that we really have a clear professional framework. Because just imagine the kind of anxiety, the whole sense of potential danger in somebody's life if they are in a state of chronic pain. Now, they perceive the world as painful all the time anyway. And the problem with something like that is that the more often the brain goes through this cascade of influencing factors, creating a specific reaction, sensory input, this is the sense of reality that is being created. What we expect at the end of it is pain. The more often they're going to be in pain just by going through their daily lives, because it's always the same sensation, so they expect getting the same outcome, which creates that outcome. Follow me so far? I know it's really difficult, especially if you didn't watch all the previous videos in this playlist. So if this sounds crazy, you might want to go back. Now, in our offices, we can really make people feel safe. That alone will bring the pain level down. And I don't want to be somebody who is a charlatan. I don't want to be selling snake oil. I don't want to use placebo effects consciously just because I learned about all these effects on the nervous system and just about me understanding how these different levels of different placebos can be used. I like to be honest, so I explain it to my clients. I really want them to understand that they can influence how their brain is processing the signal of potential danger that ends up in their brain. So what I usually tell them, particularly if their problem is a chronic problem, is that they can be a big part of their treatment just by looking for a safe environment as often as they can, and by consciously seeking experiences that help them just a little bit, even if it just makes the pain a little bit more bearable. The more often they seek out those experiences, the more they will create a new standard of normal in their brain for the pain level they're experiencing. So in treatments, in how my office is set up, in how I educate other therapists and my office staff, I always tell them these people have to feel safe. These people call our office and they're often stressed out. They're afraid. They're set up for failure in a way because they tried so often. They've been to so many other people. They've been to all the doctors, and then they went to a bunch of the alternative practitioners. And they've had these results of hope first, and then disappointment, and then feeling like, oh, it still hurts all the same way. So their expectation is already setting them up for having more pain next week. Getting out of that is by really giving them a completely different experience from the first phone call on. So that's what my reception staff has to understand. If they're short and abrupt and stressed out, they're acting just like all the other medical staff that this person has interacted with. If they're promising a lot, if they're making guarantees, if they're saying like, oh, of course, sure, we can help you, They're acting just like all the other salespeople that this patient has been interacting with. It is important to show that we care personally, but that we're very honest. So creating this atmosphere of, yes, we want to help you. Yes, we will try our best. Yes, we have a great therapist who has helped a lot of people with similar problems. That is being honest. And it doesn't mean, yes, we know we can fix this. So this person already gets a little bit more curious, like, oh, that sounds like a different place. Now, curiosity is almost the opposite of fear. Curiosity makes you want to go somewhere instead of going away from something. Curiosity really lowers the pain levels. So you see how a first interaction, when you're not even seeing somebody yet, can already influence the outcome of your treatment. Now, from then on, how is the atmosphere when that person walks in the door? Is the staff welcoming, or is, at least when there is no staff, the whole setup nice and cozy, and there is a sign that clearly states that the practitioner will be here, that they should just relax, that they can take some tea? Or do they walk into an environment that is confusing? They don't know whether they're in the right place. There is no clear information. And then there might be somebody running into another room and out again without even looking at them. That creates more of an expectation of potential danger, or at least being dismissed, not being important, another time that they're set up for disappointment. So these very first impressions can really make a big difference in helping somebody get out of pain. From there, it goes into the treatment room, and it's the same thing. So I invite you, if you are treating people who are in pain often, look at your office, look at your treatment room. Just open the door as if you are the patient walking in. Look around. Is everything making a very professional impression? Or is everything slightly chaotic and there are a few old things lying around and that cable sticking out of the wall? Is there a state of neglect somewhere? Look at it with fresh eyes, because you can really change the outcome of your treatment based on the environment you create.